Hi guys, I'm Dr. Vissio here at Briar Patch Veterinary Hospital. I'm here today to answer some questions about what is the process? How do we get blood from your dog, and what will they go through when they come in for their lab work? We've written down several of the most common questions, and Jet is going to take it away. Jet, what's the first question?
Dr. Vissio, how is blood drawn from my dog?
So typically from a dog, we'll draw blood either from the cephalic vein, which runs right along the forearm, or we'll get it from the saphenous vein that goes along the outside of the ankle area. These are readily accessible veins, easy to draw blood from, easy to restrain your pet so that we can collect that blood. We usually just get a few small vials, usually only takes a few minutes. Some pets are more anxious about that process than others, so we do go to great lengths to try and make it as stress-free as possible for each individual pet, and I think probably future questions will expand on that a little bit more.
Is the sample collection painful for my dog?
Sample collection is not painful. It can feel just like when you get blood collected, like a little pinch. Some pets are more sensitive to that than others, but we are not here to kind of manhandle or restrain your pet in a strong or painful way. We try to make it as quick and pain-free as possible. Most pets, I think, are more resistant to being restrained or just being held than they are to the actual poke itself. Just like a vaccine, they usually don't notice very much.
How is the safety of my dog ensured when getting lab work done?
So we have multiple ways to make sure that your dog stays safe. First of all, we are meeting you with them in the room for an exam prior to that, or we have recently done so if you're coming in for a follow-up technician appointment for the lab draw. So in that exam room, we are making sure that we know, exactly what tests your pet needs. So that we're drawing the correct blood sample so that we don't need to have them come back for another sample if it can be avoided. So trying to establish a plan with you from the beginning. Safety is also really important for us and for the staff. We want to make sure that we have a good relationship with your pet. If your pet has more needs, more anxiety, then we will usually work out a plan ahead of time. That often involves some very mild oral sedatives like trazodone and or gabapentin. We'll give those either the morning before the appointment or sometimes even the evening before and the morning of the appointment. That really just helps tone down the level of anxiety. It doesn't knock them out, it doesn't make them unconscious, it just makes them less reactive to being touched or being held in a certain way, because we do need to make sure that they stay safe, that they're not flying around while we're trying to collect a blood sample. We don't want to poke anywhere else or harm them. We don't want to hold them so tight that they're fighting. Not only does that escalate their anxiety, but it also, especially in maybe older, frail dogs, it could lead to injury. So it's really important for us that those dogs, all dogs, are calm when they're getting their blood drawn. If we do have a dog, that chooses to use his teeth, that are his tools, they're not always aggressive, but they will try to use the tools they have at their disposal to get out of a situation that's uncomfortable for them. Then we will ask your permission. We will use a muzzle. It's a very soft cloth muzzle. There's nothing that's poking or hurting their face if we put one of those on. If we do have a pet that has a heart condition or anything else, and we really need to monitor the color of their tongue to make sure they're not getting too stressed, we can use a basket muzzle. And again, for those dogs that maybe have underlying conditions or do get very stressed, the mild sedatives are immensely helpful, not only for us to keep staff safe, but to keep your pet safe and to keep them from that behavior escalating, getting really afraid, or potentially hurting themselves or anyone else by trying to get away. That also being said, we do put the safety of your pet above getting the sample. We kind of have like a 2-3 time try Sometimes we can tell the first time we attempt to get blood whether or not it's going to happen that day just by their behavior. My staff have been doing this. I've been doing this for many years. We know how to read pets. If we come and tell you that your pet is just too stressed, it's really because we have their best interests at heart, and would prefer to do it in a way that is going to help them and not create further problems in the future.
How soon will I receive my dog's lab results?
Lab work results can depend on a few different things. If your pet is sick here and we have the ability to run the lab work in-house, sometimes it could be 20 or 30 minutes. If we have to run multiple tests, it's possible you could be here for a couple hours. We try to minimize that as much as possible, but it's possible to have immediate results. Usually, though, for routine labs and other things for monitoring, we're sending it off to our IDEXX laboratory. That can take a few days. Sometimes we get a quick turnaround. Usually, by the time the lab work comes in, we have a chance to look at results between appointments, making phone calls, answering questions. It can take, I would say, 3 to 7 days. Some lab work, like biopsies, culture results, titers, things that go to special laboratories, those can take 1 to 2 weeks often. We usually try to let you know the time frame from which to expect us to get back to you. If you ever feel like that you haven't heard or you think something got lost, we're always open to a polite phone call, just checking in and finding out, when you can expect those. Sometimes we get busy.
Does my senior dog really need lab work done?
I find that it's especially important in senior dogs to have lab work. Age is not a disease, but as we age, we are more likely to have disease, and we can optimize your older dog's care by monitoring these lab work results. Again, catching things early. Preventative medicine is much easier and usually less costly than reactive medicine or trying to reverse a process once it's already, advanced quite far. It's also helpful for us to monitor, if using anti-inflammatory pain medications is safe for your dog. Make sure they're, not losing weight from different reasons. So I think that lab work is really important. We'll always tailor it to your dog's specific scenario or health. So that's an individual conversation for every senior dog and their owners, their pet parents. So that's something we'll always talk about. We'll offer it at every wellness visit. It may not be right for you at that time, but we can talk about how to optimize that for you and your pet.
Will my dog need more than one type of lab test?
It really depends. It depends on what is going on with them at the time. It depends on what information we can gather from the physical exam. That'll help guide whether we need to perform just one test or whether multiple are necessary. Oftentimes, if your pet is sick and they have vague symptoms, we usually are doing more of a screening. So that would include blood work, like the CBC and chemistry, potentially urinalysis, a fecal test. Those are also routine things that we do for annual screening. We'll always give you, a breakdown of what we've recommended, including costs, so that we can all be transparent and on the same page as to what tests you're agreeing to, and also how that's going to help us make decisions. We don't just run tests to have information. Although information is helpful for doctors, we feel more confident in making recommendations if we have more information. We are able to talk to you and make decisions based on what we can find, based on what we know, but always having test results are only as good as what you're going to do with them. So we always talk to you about what information is most important, and we can prioritize that, give you the list, and then go from there.
My last question is, will follow-up lab work need to be done on my dog?
That'll also depend on what the results are. If you come in for screening lab work on an annual exam and everything is normal, I say, hey, everything looks good, we can see you in a year. If we do find something that's either borderline or just outside the range, we may recommend that they come back, 1 to 3 months to have that drawn again, just to see if it's a normal patient variation or if it's a trend of something worsening. Often pets that are on routine medications, daily medications, are coming in at least every 6 months for an exam and blood work. The follow-up tests are going to be more common in things like, thyroid illnesses or kidney or liver. It really depends on what is going on with your pet, and that's also what we work together to establish a plan that's going to be most helpful. All right. I think that is all of our questions for today. If there's anything we didn't answer or you have follow-up questions, please check out our website or contact us. We're happy to go over things with you.